Hello, pod people. Mike Sokoloski, Director of Grassroots Advocacy, coming to you today with one of my favorite people, Maggie DiPasquale. Maggie is the Area Director of Government Affairs for both Hearts for Home Care and Bayada Home Healthcare. And Maggie is going to talk about some exciting stuff, Medicare. Very exciting. You think disco ball lights when you think Medicare. Everyone gets into it. So I want you to know that this is going to be a super fun episode. And I want to preface something. We're going to talk about Medicare, definitely. And the one thing we'll reference is MedPAC for our listeners. That's just something out there that a lot of people in the industry know, but I want to just give clarity before we get into these. So MedPAC is the Medicare Payment Advisory Commission, and they kind of like steer things for Medicare, but they don't. And this is my fun fact, which is not so fun, is that MedPAC, since they began, have never, ever suggested a rate increase to the Medicare payment system for home health. But that's an aside. What we're going to do today is talk about some positives and how we could make lemonade out of lemons and discuss all things federal with my friend, Maggie. So Maggie, welcome.
Thank you so much. Excited to be here. I love podcasts. So this is very exciting for me.
Excellent. All right. Well, let's get right into the super fun stuff. So, how would you describe the current state of Medicare's approach to home care? And where do you see the biggest gaps between policy and our patient or client's needs?
So it's kind of a weird time for when we look at what the approach is within Medicare, because there is definitely an understanding that people want to receive care at home. We've seen CMS state this through responses to comments. We've seen them put out a lot of different materials about people's desire to receive care where they are most comfortable in their homes. However, we are seeing a lot of payment cuts, regulatory decisions that don't really support access to care at home. So there's kind of two sides to this CMS Medicare policy framework right now. I think the biggest gap is that policy decisions are often looked at as utilization through a spending lens, instead of looking at access to care. It shouldn't always be what the utilization is. Where is Medicare spending? What does that look like for the Medicare Trust Fund? We have to look at the entire picture, which includes access to care. Who is able to receive care? Where are they able to receive care? How long does it take to receive care? It's really a twofold approach.
Excellent. And now we'll hop over to those people at MedPAC. So MedPAC that we talked about often shapes the conversation around Medicare policy. So like we said, shapes, guides, recommends. What recent MedPAC recommendations should home care providers be paying the most attention to right now?
This past March, MedPAC did recommend an additional 7% cut to the Medicare home health reimbursement rate. This is definitely significant, especially coming after years of payment instability and CMS's behavioral adjustments under PDGM. We want to make sure that we are watching what is coming out of MedPAC, because they are making the recommendations to CMS and to Congress. So it really helps us form our advocacy and the talking points that we use and what it looks like to advocate for an increase. So it's really helpful to look at those. And unfortunately, they did recommend that 7% cut.
Understood. Yeah, we've seen ongoing discussion though about reimbursement adjustments. So how are MedPAC recommendations affecting financial sustainability of our home care providers?
So MedPAC recommendations do impact the instability, because CMS does take their recommendations seriously, as well as Congress. So they do have a sense of authority and they do lead the conversation, but we are experiencing these continued cuts. And the concern is that continued cuts or payment reductions create a compounding effect, because every cut on every single year is on top of the previous year. Providers are facing increased labor costs, recruitment challenges, technology and compliance expenses, and higher acuity patients are definitely being seen as well. So when reimbursement does not keep pace with that, agencies may have to limit service areas, decline referrals, reduce staffing, or make different operational choices in order to operate within a new framework of an increasingly lower reimbursement rate. So financial instability. It's not really this abstract thing that a lot of people want to think about it at. It shows up in patient access and who gets discharged safely, where they're getting discharged, whether a nurse is available to take care of them at home, or a PT or an OT, and whether a provider can continue servicing high needs, high acuity care, or they're harder to reach patients in maybe some more rural areas.
Yes, and we do. That's rural access to care. We hear that a lot, not just in the home health side, but home care in general, and clearly a talking point when it comes to these rate reductions. So, what policy changes are debated at the CMS level? What do you think is most misunderstood about these decisions impacting patients or clients receiving care in the home?
I think what's most misunderstood is that payment policy is equal to access policy. A technical adjustment on paper can become a real life barrier for a real life patient at home who's trying to get that care. Home health is not just a lower cost alternative to institutional care. It is skilled nursing care, therapists, aides, care coordination, compliance. It's 24/7 support for this patient at home. And when reimbursement is reduced, providers can't absorb that in perpetuity. There has to be an end of what providers can absorb. And eventually it affects the capacity of the number of patients that we're able to serve. I also think sometimes people underestimate how fragile the home care workforce is. We are dealing with competing with hospitals and more institutional settings and all these different areas where we are fighting for the same population for these clinicians. And if rates don't support competitive wages and stable operations, the system will lose the caregivers that we already have. And once that workforce capacity is gone, it's really hard to rebuild. There's just not an infinite number of these skilled clinicians.
Yep, we need pseudo awareness of what a home care institution looks like. All of our legislators drive by hospitals and assisted living facilities and nursing homes, but home care you don't see. They're tiny, they're small. It's not, and that's why the advocacy part obviously is so important. These legislators don't see it. The regulars don't. They don't see our places, and it's tough. Uh, so when it comes to improving Medicare home care policy, where do you see the greatest opportunity right now, either legislative change or regulatory advocacy?
I don't know if I can say this, but I think it has to be both. The greatest
Yep.
opportunity right now is to make sure that we are aligned as an industry across the board, and that includes legislative and regulatory advocacy. Regulatory advocacy matters because CMS makes annual payment and policy decisions that have immediate impacts, and providers need to comment. We need to share data. We need to explain how those rules will affect access to care in real world situations. But legislative advocacy is also equally important because Congress sets the broader direction, and MedPAC makes recommendations directly to Congress, and they have the ability to intervene when payment policy threatens access. So the best strategy is to educate lawmakers before there is a crisis so they
Yep.
understand that home health care is part of the solution and not just another line item in Medicare spending, but also make sure that we are advocating to the people who are making the actual payment cuts at CMS as well. So it's kind of a twofold approach. They're both very important.
I think a lot of people that do what you do, uh, data sharing is something that makes a lot of people hit their head off the wall on both ends, on provider ends and on CMS and Medicare, MedPAC. Everyone, if no one wants to show their cards, and I think that is a huge problem altogether.
Yeah, I agree. I think the industry really we've done a great job this past year, especially really pulling together and making sure that everybody is on board. We've done a record number of submission of comments. People are advocating on the Hill more. It's great to see everybody out there really pulling together and making sure that we are being heard.
All right, so we'll get into the lighter things, the engagement, the advocacy, the happy people getting together. So, from your experience, what types of advocacy, direct phone calls to the legislators, meetings in person, home visits, what's most effective influencing policymakers on Medicare home care issues?
I think the most important and most impactful advocacy is anything that makes the issue seem real to that legislator, anything that an advocate can do to really illustrate how this is acting in the district in real life. So, calls and emails are important because they show volume, they show awareness. We just talked about how you might not see home health at home in your district, but it's important to know that it is there and how many people really do rely on it. Meetings are important because they allow providers and advocates to explain policy details and to answer questions in real time. But home visits are also incredibly powerful because they let policymakers see what care looks like at home. And when a lawmaker meets the patient, a family caregiver, nurse, therapist, whoever is working within that home, the issue becomes much harder to justify as just a budget number. So the best advocacy is kind of a mix of all three: clear data, a specific policy ask, and I would say more of a human story to let them know what that looks like at home.
Well, Maggie, great point there about the human story. Do you know, listeners, you can go to Hearts for Home Care's website and you could share your story via video or form submission, and we will share that with legislators and regulators abroad. Just a little plug there. If you ever want to share your story, listeners, you can go to our site and do that. All right. So for someone new, we have listeners here that maybe haven't gone into home care engagement advocacy work before. What's the simplest, most impactful step they can take today to make sure they're at the table instead of not on the menu?
I think it's exactly what you just said. I think sharing your story is the easiest and most impactful thing you can do right now. It's the simplest step, and it connects to a specific ask. So you want to make sure that you are sharing your story and then saying, "And this is why you should support X, Y, and Z." And that's really a first step that you can take. You don't need to be a policy expert to be an effective advocate. It's really just sharing your story. If you're a patient, family member, a clinician, your experience is vital into sharing this entire continuum of care. You can start by contacting your member of Congress through your Share Your Story feature and explain why home care matters to you and what challenges that you see in your day to day life, what you're experiencing as a caregiver or as a family member or a client, and why protecting access to Medicare is so important to alleviate the challenges that you are facing. I think the phrase at the table or on the menu is very true in healthcare policy. If home care advocates are not speaking up and sharing their stories, decisions are still going to be made. We've seen that this year, even while we're at the table. So they may be made without understanding the real world impact. So we have to make sure we get in there and share our experiences so the broader continuum of care is known to these legislators and decision makers.
Yep. And we always encourage on our educational calls through Hearts for Home Care, share that personal story because you're going to get uh, legislative meetings with many other groups every day. And if you can't communicate something that tugs at the heartstring, we just know that we're going to get lost in the shuffle. So we appreciate the context on that, and obviously we try to plug it as much as possible. The use of sharing stories that we could even repurpose through social output and direct communications with legislators. So, well, we're a big fan that you're a big fan of the story sharing. We're going to finish really difficult here. All right, so you have to get up, rise and shine very early when you're doing your lobbying, be it in Delaware or U.S. Capitol. So my answer to this question recently is a hot peach chai latte with a shot of espresso. That's where I'm at. So what is Maggie's go-to coffee drink to get ready to lobby?
I really like a independent coffee shop. I think going local is really important with coffee. And I recently had a really great latte on the hill that was an orange blossom latte, and it was sweetened with candied orange peel syrup. But the key is I am fully for cow's milk. I don't do like oat milk or almond milk or anything like that. I like a whole milk latte.
Right.
But I've never had a glass of milk in my life. Like I've never had a cold plain glass of milk. So that is definitely it's a little strange to have. I only have my milk and coffee.
Okay, I'm fun fact, yes, and I will agree with you. I put milk in coffee, cow milk, and the only time I have milk is with cereal, but I don't finish the milk when I'm done with cereal. All right, Mags, on the same page there. I like that.
Yeah.
All right, listeners. Well, now you know what to have before you have your legislative meetings, especially in the morning, what type of choice you should make when you go to your local coffee vendor. And with that, we would love to thank Maggie for joining us today. We hope you find this information helpful and share your story, like Maggie said, whether it be on state or federal issues. Go to heartsforhomecare.com, share your story on the link, and we hope everyone had a fantastic journey in this last half hour listening to Maggie, and we look forward to giving you some more content in 2 weeks. Have a great day.
Bye.